Vacuum cleaner hose running right through its neck here and chest. I mean, it looks like a vacuum cleaner hose. It's got those rings on it for the same reason as your vacuum cleaner hose has those rings on it. This will prevent the trachea from collapsing, because when you breathe, you actually create a negative pressure. You're a vacuum. Humans suck when they breathe. So you got those rings in it so that when you create a negative pressure or a lower pressure, it doesn't collapse the tube. If you follow it up, you can actually see the larynx two ways. I'm going to show it to you from this side, and then we'll go inside the oral cavity. But right here, see this big knot of tissue right here at the top of the trachea? That is the larynx. And you can see two of the cartilaginous elements. One right here, that's the thyroid cartilage. So if I put a pin in there, it's thyroid cartilage. This one here just kind of feels like a heavy ring. That's the cricoid cartilage. So you got thyroid cartilage and cricoid cartilage. I will ask both of those probably. And then let me go ahead and we'll look at, see if we can find the open eustachian tubes here. Mandibles are pretty tough. Now I'm just going to open this up wide. Like a big smile. Now if I can find this down here a little closer. Couple things we'll note. All right, here we go. So what you've got here, of course, this is a palate. It's hard palate here. You see I push on it, doesn't give. Now I get to here, see it's squishy, that's soft palate. But what I want you to see is, as I pull this tongue down, see this thing up here? That's the epiglottis. That's part of its larynx. It's above the soft palate. So this is, you know, up towards where the nasal cavities are. And that thing right there, above it, there's the epiglottis. Can you see it? That little leaf-shaped piece right there. So that's what I mean by humans have a descended larynx. This guy's epiglottis is above its soft palate. That's kind of weird. Now, the openings to these eustachian tubes, if I can find them, they're going to be in the nasopharynx. So I'm going to remove the soft palate. So this is soft palate. I'm reflecting out of the way a bit. If I can get it up there far enough, we should be able to see. Can you grab me another set of dissecting equipment? I need a sharp probe, one of those pin-like looking things. I've got one in it. Nope. Try that one over there. Maybe one of those tables. I need a sharp probe. Ah, that'll work. I think I'm up far enough. Hello?
I see you at 3:30.
Okay, you just gonna meet me there?
Yes.
Okay, give me a minute because they're done at 3:30, so you know,
I'm gonna get away from
a
the
little slow.
Y'all have fun now.
Oh yeah. Well, damn, I can't find it. A little light on the phone, we'll shine it down in. Oh, there it is. All right, there's a little teeny hole, it isn't much. See it right at the end of the probe, right there, right at the end of the pin. I almost missed it. There's a little teeny hole. Now what I'm gonna do to make it easier, I'm gonna take this sucker and that is in the open of the auditory tube. It's a really teeny pinhole, not much bigger than the size of that thing, but that goes to the middle of your throat. All right, so now we got the larynx, you got the epiglottis, thyroid, cricoid cartilage. You've got the trachea here. Of course, behind it, that's the esophagus, right there. Now, if I go down further, because I've removed the heart now, we should be able to see some of the airways. So that's trachea, it's gonna split into two right about here. Get some of this latex from the pulmonary arteries out of here. All right, I think you can see that splitting pretty well, right? Here's one trachea, comes down, and then you got a primary bronchus here, and you got one going this way. See them okay? Now, if you follow the primary bronchus out, these are the lobes of the cat lung. They're all separated, pretty obvious on this. You follow the primary bronchus out, and it will split into one going into each lobe. These are the secondary bronchi. See the one there? Because that's a lobe. And then there's one right here. So you got trachea, primary bronchi, and there's a couple of secondaries. Right there's one, and there's one. Secondaries go to each lobe. Now, once you're in a lobe, if you actually start removing some lung tissue, you will see the tertiary bronchi. I think you can see them right there. So if this is the secondary bronchus, see that little branch coming off it right there, right there? They're small, but right there, see, that's a tertiary. So you got trachea, primary bronchus, secondary bronchus going into the lobe. Once you're in the lobe, these are the tertiary bronchi. They go to what's called segments or lobules, which are internal compartments within the lung. But that's it. And then, of course, your diaphragm is this big muscle right here. And, of course, there's a set of serous membranes associated with the lungs. Same naming, except they're called pleural membranes in the lung. But the layer that's physically on the outer surface of the lung, that's the visceral pleura. And what's lining the ribs themselves out here, that's parietal pleura. You know, if you're eating baby back ribs, you're actually eating the poor thing's parietal pleura there. Parietal pleura, visceral pleura. That's about it. Cake, right? Yeah, we'll be. Oh, we'll burn to death. What do you miss? Like 2 all semester? Come on.
Heard a lot.
Seriously.